there's a growing recognition that working with families as part of the neurorehab journey gets better outcomes for the survivors of brain injury. That's unfortunately still not, consistently part of practice, but I think there's something that's going awry there, that actually it's really important that we're viewing family members' needs as something that's important in their own right, not just to get better outcomes for the survivor of the brain injury. So I think that families living with brain injury face unique challenges. So often people are living with a loved one who may be the same as the loved one before their injury in lots of ways, and maybe different in other ways as well. So sometimes family members can be struggling with coming to terms with changes in their loved one, and that can leave people often that can be described as a grieving process, and it can be really complicated because they can often feel incredibly grateful for the loved one that they have left, whilst also feeling perhaps that they're grieving for the loved one that they've lost, and those two things can be difficult to sit alongside each other sometimes, and often family members can still be experiencing distress many years later. And I think that some of the things that make it really challenging are that as a wider culture and society, there's very poor and limited understanding of acquired brain injury, often amongst medical professionals as well, and even amongst professionals working in neurorehab. There's not always a lot of understanding about what it might be like for family members as well. I think it's a really important question to ask. Why is acquired brain injury and the needs of families so misunderstood, given that it is one of the highest causes of death and disability in the developed world? I think for a number of reasons. I think partly there's a social political context of underfunding of brain injury services, and so then it can be seen as a luxury or an add-on to offer any support to family members, and even the amount of rehab that we see survivors of brain injury getting now is much less than even when I started my career working with people who are living with brain injury back in 2015. But also I do wonder whether something about brain injury and how it can change people's sense of self and people's identity. Something I think that is very distressing about that, for family members, for survivors of brain injury, and for professionals and for wider society. That it's something that I do think can be quite unbearable for people, and so people inherently can distance themselves, and that can be part of the context, I think, of social isolation that many survivors and families face as well. It's important that we expect that this is a family that have gone through a significant amount of trauma by the time that they've come to see us. Often, and there can be prolonged hospital stays. Often family members will come having had experiences of being told that their loved one won't survive, and if they do survive, then they can expect significant disability. And often, on the whole, the survivors of brain injury will have they'll be missing part of their own story, the story around how they've acquired the injury, and often their first part of their hospital stay or their rehabilitation. Those memories aren't available to them, and therefore the families are holding those memories, or I think they've been described, I think it was Mark Holloway, as the custodians of those memories. So I think that lends itself to trauma in particular ways, where with trauma, disruption to memory is an inherent part of what we expect to see after trauma. So I think that as professionals, it's really important that we're coming with a trauma-focused lens. It depends often where people are in the rehab journey, but I think coming with a grief lens can be important as well. So, for instance, that it might not be reasonable to expect family members to always respond to behaviours that they're experiencing as challenging in the ways that professionals might think is a helpful way to respond, because there's a whole context there for family members that we don't have as professionals. So if a person's son or daughter or husband or wife or sibling is presenting in ways that are experienced as challenging, and that more often than not is going to be a completely new way of them behaving, that carries a completely different meaning to what it's like for us as professionals who can see these behaviors day in day out as part of our professional roles. And those types of meanings might be around loss. There might be meanings around my loved one never behaved this way in the past, or it may even be that they're behaving in ways that they have behaved in the past, but in ways that are more exaggerated or different. And those can be painful for family members in lots of different ways. For most families, their life wasn't filled with rehab teams and professionals before an accident or an injury, and then we turn up, and so it's quite understandable actually that then we become part of what's happened, and that we're there out of necessity rather than out of want, and families can end up feeling very frustrated and feeling very angry and annoyed with professionals. And I think that's something that's really important for us to be able to contain and to hear and to take seriously. Just listening and validating and asking about how people are doing and seeing them as human beings and people in their own right can be something that sounds very basic, but actually can often be missed out for people. And so family members might say, you're the first person who's asked me how I'm doing, or you're the first person to recognize what I'm doing. Because I think it's really important to be actively recognizing the efforts that people are making in their lives to make things as good as possible for their loved one who's living with a brain injury. I think that hope is something that we all need as human beings, and it's something that sustains us and keeps us going through the most difficult of times. And it's something that family members in the literature and in my practice have highlighted as something that they need, and something that's important as professionals not to dash brain injury. And for me, that's something that's really important to see as a part of people's capacity for resilience, and something that's really important not to pathologize and see as something actually that's sustaining for people, and something that's needed. I'm always asking about, how are people sleeping, both in terms of the survivor and loved ones and family members. Thinking with people about, self-care and what is it that's sustaining for them and what helps them to keep going. Thinking broadly about what people's social capital might be is something that can be important to think about, and keeping an eye out for that kind of creeping social isolation that can unfortunately happen after a brain injury. One of the things that's for me important to pay attention to is what might be the unspoken, what might be going unsaid, and what might some of the hesitations about talking be. For me, one of the things that's really important, and it might sound like it shouldn't need saying, but for actually professionals not to end up in a place where they're blaming of family members or critical of family members, because I think it's a really unfortunate thing when people are facing one of the most difficult experiences of their lives that really I think is impossible for anyone to understand, and unless they've lived with it themselves, that then they can also sometimes find themselves in situations where they feel that the professional team is critical or blaming of them. And so that really just feels like a real double burden for people to have to face.